Hi, my name's Autumn. I'm going to be your nurse today. How are you?
Good, how are you?
Good. Can you just tell me your name and date of birth?
Elizabeth Bettine, July 8th, 97.
Okay, great. So the first thing I'm going to start off with is sanitizing my hands. This is practicing good infection control. I've also cleaned off my stethoscope and pen light. I've taken off all my jewelry. My patient is also sitting in her chair. She's safe, and throughout the assessment, there's nothing in this room that's unsafe, which is good. So I see you're wearing glasses. Do you use any other assistive devices?
No.
Okay, and are you currently in any pain?
No.
Okay, if you experience pain at all during the assessment, just let me know.
Okay.
So to start, could you tell me your name?
Izzy.
And where are you?
My house.
And who's the president?
Donald Trump.
So my patient is alert and oriented ×3. She's speaking clearly and articulating her words. She's also sitting erect in the chair and has good posture, which is good. So I'm going to tell you 3 words, and the words are mirror, ball, and shoe. And I'm going to want you to remember those later. So could you repeat the words back to me?
Mirror, ball, shoe.
Okay, so remember those. Now I'm going to have you stand up, please, and walk to the window and walk back. Okay, good. So I was just assessing her gait. She was walking fluidly and smoothly. There was no swaying, so she has a good gait. Now I'm going to have you stand and close your eyes, please. Okay, you can open them. So there I was testing her balance, and she did good. There was no swaying or anything like that, so her balance is good. Now what I'm going to have you do is touch each of your fingers to your thumb. And like this on your knees. And each heel to the opposite shin. Great. So there I was testing both her fine and gross motor skills, and they are intact. Now I'm going to have you close your eyes, and I'm going to touch a part on your body with my pen light, and I just want you to tell me where I'm touching.
Okay. My right leg, my left arm, and the right side of my neck.
Okay, great. You can have a seat. So there I was testing both her sensation and point localization, distal approximately and at the core, which was great. Now what I'm going to do is test your 6 fields of vision. So I just want you to follow my pen light with your eyes only. And follow it into your nose. Great. And now I'm just going to flash a light into each eye. Okay, so the pupils are equal, round, reactive to light, and they are accommodating. And now what I'm going to do is I'm going to test your peripheral vision. Okay. So when you see my fingers, let me know.
Okay. No.
Okay, so her peripheral vision is good. Now can you please smile and frown and raise your eyebrows and puff out your cheeks. Okay, so all of your cranial nerves are intact. And now I'm going to have you repeat those 3 words back to me.
Mirror, ball, shoe.
Okay, great. So now I'm going to move on to the skin assessment. So if you could just roll up your sleeves for me. So here I'm just looking at her skin, looking for anything like lesions or bruising or signs of infection. I don't see anything here. The skin is dry. The pigmentation is even throughout. And here I'm going to test her skin turgor. Almost immediate, so you're very well hydrated. Looking at the nails, I don't see any signs of infection around the nails. They're not too thick or thin. Pressing down for cap refill, less than 3 seconds, so you're getting good oxygenation. If you could put your hands like this, I don't see any signs of clubbing, so that's good also. Usually I would also assess the skin on other parts of the body, but for this, just the parts that were exposed here. I also don't see any signs of edema or anything like that, which is good. The next thing I'm going to move on to is your head, your neck, and your sinuses. So for this part of the assessment, I would usually put gloves on, and I'm looking at the scalp, moving the hair around, looking for any signs of lesions or infestations or anything abnormal. I'm not seeing anything, which is good. Her hair is evenly distributed throughout. I'm palpating the head now for any masses, and I don't feel any. The head is round and is a normal shape for her head. Her head is centered on her body, so everything is good there also. Now I'm just looking at the trach. The trachea is centered and midline to the body, which is good. I'm palpating here for the thyroid. Could you swallow for me? Okay. And do you ever have any difficulty with swallowing or anything like that?
No.
Okay. I'm just going to have you lift your glasses up because now I'm going to palpate the sinuses, both the maxillary and the frontal. Let me know if you feel any pain when I do this.
No.
No pain?
Nope.
No pain. Okay, great. You can go ahead and put your glasses down. Now I'm going to feel for your lymph nodes. So preauricular, any pain?
No.
Postauricular, any pain? Submandibular, any pain? Cervical, any pain? And preclavicular, any pain?
No.
Okay, great. So I didn't feel anything abnormal with anything in that section, which is really good there. So now I'm going to move on to the assessment for your eyes.
Okay.
I know you wear glasses, but other than that, any problem with vision?
No.
Okay, great. So I'm looking at her eyes. They're symmetrical on her face. They're oval shaped. They're both the same size. The color throughout the iris is blue. It's distributed evenly. Looking at the conjunctiva, it's pink and moist. I don't see any signs of drainage. The sclera is white. So everything looks good there. The eyelashes and the eyebrows, the hair is evenly distributed throughout as well. So now the next thing I'm going to move on to is your ears. Do you have any difficulty hearing?
No.
Okay, so I'm just going to go ahead and take a look at both sides. This side I'm noting 3 piercings. Just taking a look inside, I don't see any signs of drainage. I'm going to feel on the lobe and the tragus, any pain? Okay, I'm going to move over to the other side here. And I'm noting 5 piercings on this side. Again, looking, I don't see any signs of draining. Any pain?
No.
Any pain?
No.
Great. So the ears look good. Now I'm going to move on to your nose. I also forgot to mention the ears are both even. They're symmetric on each side. They're a good size for her head and they're where they're supposed to be. So now the nose, it's centered in her face. It's equal bilaterally. Do you have any problems with smelling?
No.
Okay, I'm just going to go ahead and take a look. Okay, I don't see any signs of drainage. I'm also noting a nose piercing. So now I'm going to assess the nares bilaterally. So if you could just go like this and puff out. And like this. Okay, great. One more thing I forgot to do for your ear testing is the whisper test.
Okay.
So what I'm going to do is stand behind you and I'm going to whisper a word in each ear and I want you to repeat that back to me.
Okay. Nurse. School.
Okay, so she did repeat the words I said, nurse and school back. So again, no problems with the ears there. I completed the assessment of the nose. Again, no problems with that. So now I'm moving on to the mouth. Do you have any problems with tasting your food?
No.
Okay, so first I'm just looking at the lips. I don't see any signs of lesions or anything abnormal there. So I'm just going to have you open wide, please. Say, okay, great. So the uvula is centered. The tonsils are an M shape. Inside her mouth is pink and moist. The mucous membranes are nice and moist there. Her teeth are in good dentition, and I don't notice any foul odor or anything like that. So everything's great there. Now I'm going to move on to the respiratory part of our assessment.
Okay.
So I'm going to listen to your lungs. Do you have any shortness of breath or difficulty with your breathing?
No.
Okay. So I have been analyzing her respiratory rate throughout this assessment, and it's within normal limits, so that's really good. I'm also noting that she has a cone shape, which is what we're looking for, no barrel shaping, which is great. Her chest is rising and falling bilaterally, so everything is good there. I'm just going to have you stand up, please. And I'm just going to assess that her lungs are expanding. So if you could take a deep breath in and exhale, and again. Great, you can go ahead and take a seat. So her lungs are expanding how they're supposed to. I knew that because my thumbs separated about 1 inch apart, which is what we're looking for. So now what I'm going to do is I'm going to listen to her lungs, both anteriorly and posteriorly. So I'm just going to start here. And a deep breath in. And again. Okay, now we're going to do your back. And on the right side. Okay, great. So the lung sounds were clear bilaterally. I didn't hear any signs of wheezing, bronchi, stridor, anything like that. So everything's good there. I also made sure to listen in the intercostal spaces, and I was not on any bone. So now I'm going to move on to the cardiac part of the assessment. Again, if you wouldn't mind rolling up your sleeves, I'm just analyzing here for oxygenation and perfusion. I don't see any signs of cyanosis in her lips and her fingers. I did her cap refill earlier, which was less than 3 seconds, so you're oxygenating and perfusing well. You don't experience any chest pain or anything like that? No. Okay, good. So now what I'm going to do is I'm going to listen to the heart. And I'm going to use both the diaphragm and bell of my stethoscope for this, ape to man. And using the other side. Okay, so everything sounds great there. I didn't hear any signs of a murmur, bruits, or anything like that. Now I'm going to palpate your chest area. And here I'm just palpating and feeling for any thrills or masses or heaves, and I do not feel any, which is what we're looking for. One last thing to listen to here is I'm just going to listen to your carotid pulse on both sides. Okay, so I heard her carotid pulse bilaterally, and I was assessing for any bruits or things, and everything sounded clear and great, which is what we're looking for. And now I'm just going to assess your other pulses. I'm just going to feel here for the carotid. Okay, and the other side. Okay, pulses are strong, and then I'm going to do the radial pulses on each side. And here. Great. And on the top of the foot. And behind the ankle. Okay, so all pulses were present and they were strong. I would say about a +2, which is what we're looking for, so that's great. The next part of our assessment is the abdominal portion. So if you would please lay down for me. Okay, so I'm just going to have you lift up your shirt for me, and the first thing I'm doing is I'm just assessing for any distension, any sign of ascites. I don't see any. Everything looks great. Do you have any problems with your stomach? No. Okay, great. And now what I'm going to do is I'm just going to listen in all 4 quadrants for the presence of bowel sounds. Okay, so bowel sounds were present in all 4 quadrants, which is what we're looking for. I'm also noting a belly button piercing here. And now what I'm going to do is listen to the vasculature sounds. So I'm listening to the aortic sound now. And the renal. And the iliac. And everything sounds great there. Now what I'm going to do is I'm going to palpate your stomach and feel around. If at any point you feel any pain, please let me know. Any pain?
No.
Any pain?
No.
Okay, great. So that completes the abdominal portion of my assessment. Everything seems great there. Now, if you wouldn't mind just standing up one last time for me. And I'm going to have you dive down toward your feet. I'm going to assess your spine. I'm feeling down the spine. It's straight. There's no deviation for the midline. Her shoulders are even. You can go ahead and stand up. You can take a seat now. So there's no signs of scoliosis or abnormal curvature there, which is good. And now what I'm going to do is I'm going to test both the range of motion and strength in your upper and lower extremities.
Okay.
So we'll start at the top. You could just move your head back and forth. Any pain with that?
No.
Okay, you could move both of your shoulders. Any pain?
Nope.
Okay, and the elbows, the wrists, and the fingers. Any pain there?
No.
Okay, great. So I'm not seeing any pain or signs of crepitus, which is good. Now what I want you to do is I just want you to shrug your shoulders against the resistance of my hands. Okay. And put your arms out flat and push up. Good. And push down. And grip onto my hands. Great. So the strength in her upper extremities is equal. Bilaterally, they're strong. Full range of motion there. So that's what we're looking for. If you wouldn't mind laying down for your lower extremities. So for range of motion, I'm going to have you lift one of your legs up and down and out to the side. Great. And the other side and out. And then if you would just bend your knee for me and the other leg. All right, and roll your ankles and the other side. And then could you move all your toes for me? Great, so she has complete range of motion in her lower extremities as well. You could sit back up for me just for the strength portion. So what I'm going to have you do is push up against my hands, great, and push down, and push with like a pedal, and push like a pedal. Great, so in her lower extremities, the strength is equal bilaterally as well. She has full range of motion in all her extremities. So I think that completes my assessment. Did you have any questions for me?
No.
Okay, great. Thank you.
Thank you.